think the role of a patient's partner in their odyssey through their disease and the treatment and, God willing, the best outcome is something that it's very easy to underestimate. I personally find that as a patient faces the challenge of his or her illness, the role of the partner to be able to maintain an objectivity around the information that's provided and essentially be another set of eyes and ears looking at the same issue, but with obviously the very best interests of the patient at heart, is invaluable. And I think if I look at best outcomes for patients, I think that it truly reflects the strength of the team around them, be it not only the provider, but also what the patient is fortunate to hopefully have in terms of family support and a partner. So partners, I think, play a huge role. They can be more objective in their assessment of the information. Obviously they're concerned for their partner, that's clear. But they can also, I think, objectively be a little less scared, because it's not directly them necessarily, although obviously they're worried. And they can help diffuse some of that anxiety by taking it on board. I think you make a very good point, though, Charlie, that it's very stressful on a relationship to face something like this together. But I have seen it actually bring couples much closer together and actually enhance their relationships. I wouldn't see it as necessarily a negative. I would see it far more likely as a positive. There is one caveat to that, and that's the impact of steroids. Steroids remain part of our armamentarium, and I think that we believe in trying to be steroid-free, or at least less steroid is more, because not least for patients and their emotional state, this can be very challenging. And it's interesting, Charlie, whenever I ask a patient about how the steroids are treating them, I always make sure to ask the partner, because that's the person who really knows how impactful steroids are on that particular patient.